Welcome to the deep dive. Today, we're going to be exploring, the cutting edge of healthcare. We're focusing on long COVID care and the potential of AI.
Right.
And, you've sent in a mix of medical news articles, research publications, and even some personal stories. So
Right.
let's break down, what's most important.
Absolutely.
We want you to walk away feeling like really well informed about the latest findings,
Yeah.
about potential treatments.
Yeah. It's an exciting time to be talking about this stuff because we're seeing this convergence
Yeah.
of technology and medicine in some really innovative ways.
Yeah, absolutely.
Yeah.
One of the articles that you sent in from the University of Pennsylvania really caught my eye. It talks about how AI can analyze electronic health records
Right.
to better understand long COVID in young people.
Yeah. And this study is really fascinating because it used machine learning,
Right.
a technique called latent transfer learning. And it used it to look at data from 8 different children's hospitals.
Wow.
So imagine teaching a computer to recognize patterns in medical information from one hospital
Okay.
and then apply that knowledge
Yeah.
to patients in a completely different hospital.
Wow.
That's essentially what latent transfer learning does.
Oh, okay.
And particularly helpful when you're dealing with really complex conditions like long COVID.
So it's like having like a medical detective
Yeah.
that can spot clues hidden in massive amounts of data.
Exactly.
Wow.
And by analyzing all this data, the researchers were able to identify 4 distinct subgroups
Okay.
of young people with long COVID, each with unique characteristics and needs.
Wow.
This is crucial because it means that long COVID isn't a one-size-fits-all condition.
Right.
Your individual medical history could play a significant role in how the illness manifests
Okay.
and what treatments might be most effective for you.
That makes a lot of sense.
Yeah.
So instead of just treating long COVID as a single disease,
Doctors could tailor treatment plans based on these subgroups.
precisely.
Wow.
Imagine this system in place during the peak of the pandemic.
Oh, wow.
Researchers believe it could have helped hospitals anticipate
Okay.
which departments would see the most long COVID patients, how many ICU beds they might need,
Right.
allocate resources more efficiently.
Wow.
Potentially, this could even help lessen the overwhelming impact on the healthcare system.
That's incredible.
Yeah.
It shows how AI can play such a vital role
Yeah.
in shaping the future of healthcare, not just through like robots performing surgeries, but through analyzing data
Right.
to improve patient care.
Absolutely. It also highlights the importance of collaboration and data sharing between hospitals.
Yeah.
The more data these AI systems have access to, the more they can learn,
Yeah.
the more accurate their predictions become.
This makes me think about the ethical considerations
Mhm.
of using such powerful technologies.
Yeah.
Are there any concerns about patient privacy?
Or potential biases in the data.
Those are definitely important questions
Yeah.
to consider. Anytime we're dealing with sensitive medical information,
Yeah.
we need to ensure that privacy is protected,
Right.
that the data is used responsibly and ethically. As these technologies evolve,
Yeah.
it will be crucial to have these open discussions about these
Yeah.
issues to develop safeguards to mitigate potential risks.
I agree. It's important to acknowledge both the incredible potential and the ethical challenges that come with these advancements.
Absolutely.
Speaking of personalized approaches to treatment, one of the sources you provided
Yeah.
focused on a possible treatment for long COVID.
Right.
That's been generating a lot of discussion.
Yeah.
Extended use of Paxlovid.
Yes. This is a patient-led case series
Okay.
published in Communications Medicine. And it's a really interesting example of how patients are taking an active role in exploring potential treatments.
It sounds like the patients involved in this study were really motivated
Yeah.
to find solutions.
Absolutely. They were experiencing ongoing symptoms and were willing to try something outside the typical treatment guidelines.
Right.
It's important to note that the results of this study were mixed.
Okay.
Some participants experienced significant symptom reduction
Okay.
with the extended Paxlovid course, while others saw no effect, and some even had to stop due to side effects.
So it's not a guaranteed cure for everyone.
Right.
But it's intriguing that some people saw real benefits.
Yeah.
What are your thoughts on the implications of these mixed results?
Well,
Does it change how we should approach long COVID treatment?
I think what's so fascinating here is that it opens up this new avenue for research.
Okay.
This study raises questions about the optimal dosage and duration of Paxlovid treatment for long COVID. and it highlights the need for personalized approaches.
Yeah.
What works for one person
Right.
might not work for another.
Right.
And we need to be really careful about drawing sweeping conclusions from a small case series.
That's a great point. So while we shouldn't get ahead of ourselves,
Yeah.
this study does offer a glimmer of hope and suggests that further research into extended Paxlovid use for long COVID is warranted.
Exactly.
Yeah.
It's also important to acknowledge the courage and initiative of the patients who are participating in this study.
Yes.
They took a risk.
Yeah.
They shared their experiences, contributed valuable data that could help others in the future.
Absolutely.
Yeah.
Their willingness to try something new and to document their experiences is incredibly valuable to the medical community.
I completely agree. It really underscores the importance of patient voices and their role in driving research and innovation.
Speaking of innovative approaches,
Yeah.
our next source takes us into a completely different realm of healthcare.
Okay.
The world of digital therapies.
Yes, this study focused on a digital women's pelvic health program and its potential to help women manage chronic pelvic pain, a condition that can be incredibly debilitating. This particular program is fascinating because it combines personalized exercise therapy, educational materials, and health coaching, all delivered digitally through a smartphone app.
So it's basically like having a pelvic health expert in your pocket.
It is.
That's amazing.
It is quite remarkable.
Wow.
And what makes this study even more compelling is that it included a comparison group.
Right.
So researchers could really see how those using the digital program fared compared to those who didn't. The results were pretty impressive.
I'm really curious to hear about those results.
Yeah.
Did the digital program actually help reduce pain?
Yes. The study published in BMC Women's Health found that participants using the digital program experienced significantly greater pain reduction at both 4 and 12 weeks compared to the group who did not use the app. This suggests that a well-designed digital program can be a really powerful tool in managing chronic pelvic pain.
This is so encouraging. It seems like digital therapies are really gaining traction.
They are.
Demonstrating real benefits for people with chronic conditions.
They certainly are. And it's not just about pain reduction either.
Right.
This program also showed a positive impact on depression symptoms.
Wow.
Which highlights the interconnectedness of physical and mental health.
Yeah.
You know, when you're dealing with chronic pain, it's bound to affect your mental well-being as well.
That makes a lot of sense. It seems like a holistic approach that addresses both the physical and emotional aspects of a condition is really important.
Right.
This digital program sounds like a fantastic example of that.
It is. It also opens up access to care for people who might not have the time or resources for traditional in-person therapy.
That's a really crucial point. Not everyone has easy access to specialists or can afford ongoing treatment. Digital therapies have the potential to bridge that gap, make healthcare more accessible and equitable.
Absolutely.
Yeah.
This study represents a significant step forward in demonstrating the effectiveness of digital health solutions.
Now, shifting gears a bit, let's talk about a topic that we haven't heard as much about lately, Mpox.
You're right. The intensity of the virus is still circulating, and we're still learning about its long-term effects.
Yeah.
One of the sources you provided a review, published in Infection and Drug Resistance, delves into the urogenital manifestations of Mpox, which are often overlooked.
Urogenital manifestations.
Yeah.
I have to admit, I'm not entirely familiar with that term.
It essentially refers to how the Mpox virus can affect the reproductive and urinary systems. While Mpox is often associated with skin lesions, this review emphasizes that it can also directly impact organs, particularly those of the urogenital system, leading to a variety of complications.
So even though we might not be hearing about Mpox in the headlines as much these days, it's still a concern.
It is.
Especially when it comes to potential long-term impacts.
Exactly. This review serves as a reminder that even when the immediate threat of an outbreak subsides, the impact of a novel disease can linger.
What are some of the key takeaways from this review that our listeners should be aware of?
Well, the review highlights that penile lesions are the most common urogenital manifestation of Mpox, followed by urethritis, which is inflammation of the urethra. But they also emphasize rarer but serious complications, like acute urinary retention, meaning difficulty urinating, and even kidney injury.
That's concerning. It sounds like the medical community is still working
They
to
are.
understand the full scope of Mpox
Yeah.
and its potential long-term consequences.
They are. And this review underscores the importance of continued research awareness and vigilance,
Right.
even as the outbreak is no longer considered a global health emergency.
This brings us back to the importance of patient advocacy,
Mm.
the power of personal stories, which
Yeah.
we touched on earlier.
Yeah.
I'm thinking about that collection of narratives from individuals navigating long COVID.
Right.
What struck you as particularly compelling about those stories?
What resonated with me was the sense of desperation
Yeah.
and the willingness to try anything, even unconventional treatments, in the hope of finding relief from debilitating symptoms.
Right.
It was a raw and honest look at the challenges of living with a condition that is still not fully understood.
It's easy to get caught up in the scientific data,
Right.
the research findings.
Yeah,
But those personal accounts remind us that there are real people behind the statistics.
absolutely.
People whose lives have been profoundly impacted by this illness.
And their voices are crucial
Yeah.
in shaping research priorities,
Right.
advocating for better care and support.
Right.
They provide a perspective that research studies alone cannot capture.
Their stories can also help to raise awareness.
Reduce the stigma associated with conditions like long COVID, which can be so isolating.
I couldn't agree more. The more we share these experiences, the
Hmm.
more we can foster understanding and empathy,
Yeah.
which can ultimately lead to better support systems and resources for those affected.
This leads us back to that patient-led case series exploring the potential of extended Paxlovid courses for treating long COVID.
Yeah.
It's really quite remarkable that patients themselves spearheaded this research.
It is. It's a testament to the power of patient advocacy.
Yeah.
These individuals were experiencing persistent symptoms,
Mm-hmm.
felt that the standard 5-day course of Paxlovid might not be sufficient.
Yeah.
So they took it upon themselves to explore a different approach,
Wow.
documenting their experiences and sharing their findings
Wow.
with the medical community.
What was the rationale behind extending the Paxlovid treatment?
Well, the idea is that long COVID might be linked to persistent viral activity
Okay.
or reservoirs of the virus in the body.
By extending the duration of antiviral treatment,
Yeah.
you might be able to target those lingering viral reservoirs and potentially alleviate symptoms.
It sounds like a plausible theory, but as you mentioned earlier, the results were mixed.
Right?
Could you elaborate on those findings?
Of course. One participant, a man in his 50s, reported significant improvement in his energy levels, muscle fatigue, and even cognitive symptoms
Wow.
after completing a 15-day course of Paxlovid.
Okay.
This was really encouraging.
Yeah.
But another participant, a woman in her 30s,
Okay.
had to stop the extended course early due to severe stomach pain.
So it's not without risks.
Right.
And it's certainly not a one-size-fits-all solution.
Right.
What about the participants who took Paxlovid during an acute reinfection?
2 individuals in the study took the extended Paxlovid course during a reinfection.
Okay.
Interestingly, both reported eventually returning to their pre-reinfection baseline.
Wow.
This suggests that managing acute reinfections aggressively might be key to preventing a worsening of long COVID symptoms for some people.
That's a fascinating observation.
Yeah.
It highlights the complexity of long COVID and the need for personalized treatment strategies.
Right.
What do you think are the most important takeaways from this study for our listeners?
I think the key takeaway is that this patient-led research has opened up this new avenue for exploration. While the results are far from conclusive,
Right.
they suggest that extended Paxlovid courses might hold promise
Yeah.
for some individuals with long COVID.
Okay.
However, more research is absolutely needed to determine the optimal dosage duration
Right.
and to identify who might benefit most from this approach.
Okay.
It's crucial to consult with a healthcare professional before making any decisions about treatment.
That's sound advice.
Yeah.
It's so important to have those open conversations with your doctor about your individual symptoms.
Yeah,
Make informed decisions about treatment options.
absolutely. And I think this study also highlights the importance of patients advocating for their own health.
Yeah.
Being active participants in their care.
I completely agree. Now, before we wrap up this part of our deep dive, let's revisit that study on digital therapies for chronic pelvic pain.
Okay.
You mentioned earlier that this study focused on a smartphone app that combined several different elements.
Yes. It's a great example of how technology can be harnessed to create a comprehensive and accessible healthcare solution. This particular app incorporated personalized exercise therapy tailored to each user's needs.
Okay.
Educational materials about pelvic pain and its management,
Right.
and access to health coaching from qualified professionals.
It sounds like a really well-rounded approach. And
Yeah.
what were the specific findings of this study? Did the app actually help improve symptoms for the women involved?
It did. The study published in BMC Women's Health
Okay.
found that participants using the app experienced significantly greater reductions in pain
Oh, okay.
compared to those who didn't use the app.
Okay.
This was true at both the 4-week and 12-week marks, suggesting that the benefits were sustained over time.
That's remarkable. It really underscores the potential of digital therapies to make a real difference in people's lives.
And it's not just about the numbers.
Right.
The participants in this study also reported improvements in their overall quality of life
Okay.
and a greater sense of control over their condition.
Hmm.
They felt empowered to take an active role in managing their pain and to make positive changes in their daily lives.
That's so powerful. To regain that sense of agency and control over your own health is incredibly valuable.
It really is. And it speaks to the importance of patient-centered care and empowering individuals to be active participants in their own healing journeys.
Now, shifting gears one last time, let's delve into the complexities of Mpox,
Okay.
a disease that has brought up important questions about public health,
Right.
stigma, and the long-term impacts of a novel virus.
You're absolutely right.
Yeah.
While the Mpox outbreak might not be dominating the headlines like it was a year ago,
Yeah.
it's crucial to remember that the virus is still circulating.
Right.
And we're still learning about its potential long-term consequences.
Right.
One of the sources you provided, a review published in Infection and Drug Resistance,
Okay.
delves into a particularly concerning aspect of Mpox. Its urogenital manifestations.
That's a term I have to admit I'm not fully familiar with. Could you explain what it means and why it's significant?
Of course, urogenital manifestations essentially refer to how the Mpox virus can affect the reproductive and urinary systems.
Okay.
While Mpox is often associated with those distinctive skin lesions,
Right.
this review highlights that it can also directly impact organs, particularly those of the urogenital system.
So even though we might not be seeing those widespread outbreaks anymore,
Right.
the virus is still capable of causing serious complications,
Yeah.
particularly in the urogenital system.
Exactly. This review is a call to action, reminding us that even when the immediate threat of an outbreak seems to have passed,
Yeah.
the impact of a novel disease can linger sometimes in unexpected ways. It's a stark reminder that vigilance and ongoing research are crucial.
It sounds like we still have a lot to learn about the long-term effects of Mpox.
Yeah.
What are some of the key takeaways from this review that our listeners should be aware of?
Well, the review emphasizes that penile lesions are the most common urogenital manifestation of Mpox,
Okay.
followed by urethritis, which is inflammation of the urethra.
Okay.
However, they also highlight rarer,
Yeah.
but much more serious complications like acute urinary retention, meaning difficulty urinating,
Oh, wow.
and even kidney injury.
That's really concerning. It seems like the medical community is still working to understand the full scope of Mpox
They are.
and its potential long-term consequences. What does this mean for people who have been infected with Mpox?
It underscores the importance of ongoing monitoring and follow-up care.
Right.
If you've had Mpox, it's crucial to be aware of any unusual symptoms, particularly those related to your urinary or reproductive health,
Mm-hmm.
and to seek medical attention if you notice anything concerning.
That's sound advice.
Yeah.
This discussion really highlights the need for continued research and awareness, even when a disease isn't making headlines. It
Yeah.
makes me wonder what other potential health challenges might be lurking beneath the surface.
You bring up an excellent point.
Yeah.
We live in a world where new health threats can emerge unexpectedly,
Right.
and it's crucial to be prepared
Yeah.
to invest in research and public health infrastructure.
I completely agree. Now, before we move on to our final thoughts, I wanted to revisit one of the themes that has woven its way through our conversation today: the power of patient voices
Right.
and their impact on research and healthcare.
Yes, that's been a recurring and incredibly important theme throughout our deep dive today.
Yeah.
We've seen how patients are driving research, advocating for new treatments, and sharing their experiences to raise awareness and reduce stigma.
Those personal stories about living with long COVID were particularly powerful.
They were.
They provided a glimpse into the daily struggles and triumphs of individuals navigating a complex and often misunderstood condition.
They did. Those stories remind us that behind the data and the research findings, there are real people whose lives have been profoundly impacted by this illness.
Yeah.
Their experiences offer invaluable insights that can inform research,
Right.
shape policies,
Mm-hmm.
guide healthcare providers in delivering more compassionate and patient-centered care.
And we can't forget that patient-led case series exploring extended Paxlovid use for long COVID.
Absolutely.
It's truly remarkable that patients themselves took the initiative to explore a potential treatment option.
It's a shining example of how patients can be powerful agents of change within the healthcare system.
Yeah.
They brought a unique perspective to the table, identified a potential gap in treatment approaches, and then took action to gather data and share their findings with the medical community.
Their willingness to step outside the conventional treatment guidelines and to document their experiences is incredibly valuable, not just for themselves, but for countless others who are struggling with long COVID.
I couldn't agree more. This study has sparked a crucial conversation about the potential benefits and risks of extended Paxlovid use.
Right.
And it has paved the way for further research that could ultimately lead to better treatment options.
Yeah.
It's a testament to the power of patient advocacy and the importance of collaboration between patients and researchers.
This brings us to an important question. What does this all mean for our listeners?
Yeah.
What can they do to become more involved in patient advocacy?
There are so many ways to get involved.
Okay.
It can be as simple as sharing your story on social media,
Right.
joining an online support group,
Okay.
or contacting your elected officials to advocate for policies that support research and access to care.
Okay.
You can also participate in research studies, volunteer with patient advocacy organizations,
Mhm.
or even just educate yourself about a particular condition and help to spread awareness.
It's about finding what resonates with you and using your voice, your experiences, and your passions to create positive change within the healthcare system.
Exactly.
Yeah.
And remember, even small actions can have a ripple effect.
Yeah.
Every voice matters.
Yeah.
Every story shared can make a difference.
That's a really empowering message. It can feel overwhelming to think about tackling systemic issues in healthcare.
It can.
But even individual acts of advocacy can contribute to a collective movement for change.
Absolutely.
Yeah.
And I think that's a perfect segue to our final thoughts.
Okay.
As we navigate this rapidly changing landscape of healthcare, one thing remains clear. Collaboration is key. By sharing knowledge, listening to patient experiences, and embracing cutting-edge technologies, we can pave the way for more personalized, effective, and accessible healthcare for everyone.
That's a perfect way to sum up what we've explored today.
Yeah.
We've covered a lot of ground from AI-driven healthcare to digital therapies
Yeah.
and the importance of patient advocacy.
And as we've seen, these advancements aren't just happening in isolation.
Right.
They're interconnected, influencing and shaping each other in profound ways.
It's like we're witnessing a convergence of forces,
Yeah.
all pushing healthcare toward a more patient-centered and data-driven future.
Exactly. And that future is being shaped not just by scientists and researchers,
Right.
but also by patients themselves.
As we were diving into these sources,
Yeah.
one question kept coming back to me. What role do we play in shaping this future of healthcare? Not just as individuals, but as a collective force.
That's a fantastic question and one that's central to everything we've discussed today.
Yeah.
It's clear that patient advocacy is playing an increasingly important role in driving research-shaping policies and pushing for better care.
The patient-led study on extended Paxlovid use for long COVID is a perfect example of that.
Absolutely.
These individuals weren't content with the status quo. They took matters into their own hands.
Mm.
And their efforts have the potential to benefit countless others.
It's truly inspiring to see patients becoming such active participants in their own care
Right.
and in shaping the direction of medical research.
Yeah.
And it's not just happening with long COVID. We're seeing this trend across a range of health conditions, from chronic pain to rare diseases.
It's like a new era of patient empowerment is emerging, fueled by technology, social media.
Yeah.
A growing recognition that patient experiences are invaluable.
Those experiences provide a perspective that research data alone can't capture.
Right.
They humanize the statistics, highlight the real-world impact of diseases, and challenge researchers and policymakers to think differently.
I'm thinking about those powerful narratives from individuals living with long COVID that we discussed earlier.
Yeah.
Their stories weren't just about symptoms and treatments. They were about resilience, hope, and the importance of community.
Those stories can be catalysts for change. They can raise awareness, reduce stigma, and inspire others to get involved in advocacy efforts.
Right.
And they remind us that healthcare is not just about science and technology, it's about people.
This brings me to a question for our listeners. What can you do to become more involved in patient advocacy?
There are so many ways to make a difference, big or small. It could be as simple as sharing your story on social media or joining an online support group. You could reach out to your elected officials to advocate for policies that support research and access to care for a particular condition.
Or you could participate in a research study, volunteer with a patient advocacy organization, or simply educate yourself about a health issue that's important to you.
Exactly. Find what resonates with you and use your voice, your experiences, and your passions to create positive change.
It can feel overwhelming to think about tackling systemic issues in healthcare.
Right.
But remember, even small actions can have a ripple effect. Every voice matters. Every effort counts.
And as we've seen from the sources you provided, collective action can lead to real progress.
So whether you're a patient, a caregiver, a healthcare provider, or simply someone who cares about the future of medicine, I encourage you to get involved.
Your voice matters. Your experiences matter. And together, we can shape a healthcare system that truly serves everyone.
What a thought-provoking and inspiring way to wrap up this deep dive. Thank you for joining us on this journey of exploration and discovery.
It's been a pleasure diving deep with you. Keep asking questions, stay curious, and never underestimate the power of your voice.